The Catholic Relief Services CRS, with the financial support from the U.S. government through USAID, has been implementing the AIDS Population and Health Integrated Assistant People-Centered Leadership Universal Access Sustainability Program, in short AFYA+, in Kenya for the past 7 years. This has been implemented on 2 project fronts since the year 2011, Nuria Bonde in the Rift Valley and Imarisha focusing the northern arid land regions of Kenya. The main goal was to improve access to health services in 6 counties in the Rift Valley and 8 counties in the northern arid land regions. Through collaboration with 16 local implementing partners and communities at the grassroots level, AFYA+ has been able to touch and transform the lives of thousands of individuals through a number of initiatives. These include the Economic Strengthening Initiative, HIV care and treatment, care and support for orphans and vulnerable children, and community quality care structures. To make this happen, the Catholic Relief Services in Kenya adopted the organization's integrated orphan and vulnerable children model to access social determinants of health to improve the well-being of 75,000 OVC and 4,000 people living with HIV in Nuria Bonde, as well as 39,447 OVC in the NL counties. With the support of AFYA+, this was made possible through the guided formation of support groups for OVC caregivers and people living with HIV. Members of the said support groups are able to gain easy access to psychological social support, nutritional support, and decent housing. With the program support, households with orphaned and vulnerable children are also empowered economically. They contribute money, save and lend it out to group members who invest the money in income-generating activities such as retail shops, tailoring and agribusiness. George Okoth, the CRS team leader for health, explains the key areas of engagement.
Our project is family-centered, anchored in on the aspect of household economic strengthening, that we wanted to build the capacity of the household, not an individual, so that these households are able to now take care of themselves without depending on the donor support. And we've done it well, and moving from the case management to the graduation aspect of it, looking at the child from the time the child is enrolled, and we've involved the Department of Children's Services, being the line ministry, and at the same time the Department of Civil Registration, as well as the police, for enforcing the legal aspect of it. And we have seen some improvement in it. We also look at the wash activity, because when we go at the household, we look at the aspect of the wash. Do they have the hygiene aspect or sanitation and hygiene component of it? We started by a bit of hardware in Nal, but we pulled out of the hardware and we are doing the wash software.
In the KCC slums of Morindat, Naivasha, 2 OVC caregivers are reaping the benefits of silk. Teresa Akinyi, a member of KCC Morindat OVC Caregiver Silk Group, has taken 2 loans which she used to buy 2 tailoring machines. She now earns enough money from her tailoring business to feed her 3 children and pay school fees for the firstborn. Her colleague Milka Mudhoni Kihara took a loan which she used to stock her grocery shop. From the earnings, she has bought a piece of land she dreams not to pay rent in future. Block granting is yet another approach implemented by the program to bolster institutions that support the OVC under their care. This can be seen in Wamba Boys High School in Samburu County, where students have established a poultry farm. The proceeds from the chicken project are used to support OVC in school, including paying their school fees. Sanitation, availability of water and hygiene is a key element in ensuring these children remain healthy and out of danger. In Narok County, AFYA+ has supported a local group in securing a local spring, therefore ensuring group members have access to clean and safe water for their daily use. Strengthening coordination of care across community stakeholders is another goal that has been achieved by AFYA+. Thanks to AFYA+ pupils, teachers and the community living around the school in Metili location can now access clean water, owing to the availability of water tanks at Eor and Tepesi Primary School. This has led to increased access to water, sanitation and hygiene, access to clean water for cooking, drinking, cleaning and basic sanitation helps protect OVC and people living with the HIV from illnesses. The AfyaPlus program also helped set up community care structures through quality improvement teams, link desks, community health volunteers who identify and flag households in dire need, and private service providers who provide technical support to the silk groups. In Kware slums of Ongata-Rongai town, the Kware Quality Improvement Team not only formed a boys-to-boys link desk to help in reaching out to boys in the slums, especially those who are affected by the slum life of poverty and illicit brews. The team, composed of people from various sectors of the society, embarked on the Operation Rudi Shuleni campaign to take back to school children who had resorted to street life. As a result, the team managed to rescue 19 children from the streets. These children were reunited with their parents as some of them also got back to school.
Tuliweza kufanya program moja ambayo tulikuwa tunaita Operation Rudi Shuleni. Ni operation ambayo ilikuwa tulionelea inafaa baada ya kugundua kwamba kuna watoto wengi wako kwenye barabara na ambao hatuelewi ni kwa nini hawako shule, na tungelitaka kujua sababu hizo. Kwa hivyo tuliweza kufanya hiyo operation na tukafaulu, tukaweza kushika watoto 19 ambao tulienda tukawafanya profiling. Watoto 12 walipata kurudi kwa wazazi wao, watoto 7 walipata, kulikuwa na changamoto kwa hao 7, lakini kwa njia moja ama nyingine wengine waliweza kuingizwa kwa children's home kwa muda mfupi kama bado mambo yao yanajulikana, na saa hii tunavyoongea ni kwamba kila mtoto amerudi kwao.
We've been working with the QI team, which is an AfyaPlus project and a beacon of hope. On the particular time on 8th of August 2016, we worked together on an operation they called Operation Rudisha Watoto Shule.
In Nakuru, for instance, the 26 link desks work with 68,300 people. As a result of these interventions, the projects enabled people living with HIV, orphaned and vulnerable children and their caregivers to live healthy, normal and productive lives. The AfyaPlus Imarisha component focused mainly on transition and graduation of OVC and their households. This is explained by Bill Oko, the Catholic Relief Service AfyaPlus Imarisha project manager. AfyaPlus project has been able to reach many beneficiaries since it worked with local implementing partners to reach the communities at the grassroots.
We've worked very closely with the people on the ground, and these people on the ground for us are like the implementing partners, and we call them local implementing partners. Then our focus for the 6th year was really transition and graduation of this OVC program, and this is something that was inbuilt into the program to basically say that we are not going to have funding for eternity. We in the 6th year worked very closely with a team that we constituted called the transition team. Now this transition team is actually the pivot team that is driving the entire agenda of transition and graduation of the OVC. And as we speak now, we can talk about a lot of success. We have counties that have expressed the need to, or the ability to take care of these children.
As a result, 5,965 OVC and 3,062 households were graduated, with another 6,542 and 3,238 households on the path to graduation in the NL region. In Moyale, the local silk group has taken advantage of the local environment to set up an animal lodge. The Galumate OVC caregivers and support groups saw animals travel hundreds of kilometers to get to the Moyale livestock market. They saw an opportunity in this and took advantage by setting up an animal lodge that is a resting place. Thanks to the support from the program, they were able to set up this and now make an average of 4,000 shillings per day. The cash is used to take care of OVC households. The project is now self-sustainable and will be helping the households for a long time to come. Women from the Samburu community, which is known for its dependence on livestock, have been taught to grow vegetables. This supplements their diet and that of OVC, as well as supplement their income when they sell the greens. Selena Kathuri has been a community health worker for 4 years. She received training through the Imarisha Afya Plus program and put her skills and knowledge towards training support groups in income-generating activities such as kitchen gardening. She also offers health education to enlighten the caregivers on their various health needs and those of orphaned and vulnerable children. 6 of the OVC under her care are ready to graduate.
As a private service provider, I'm able to go all over Isiolo County North to teach many groups or form many forums and teach them about silk, where they are able to support these OVCs we have in Afya Imarisha. Organized and form a group which is CBO. It consists of 50 members, and these members are able to help OVCs or to help in educating these groups more about health and how they can get income generating activities which are enabling them to support these OVCs.
Another beneficiary of the program is an ambulance driver, Zakayo Leparia, who was able to get a driving license.
Maisha yangu yamebadilika tangu nilipojiunga na kikundi cha SCAP, ambayo wamenisaidia sana nikapata cheti ya driving school na cheti ya kuendesha gari, ambaye kutoka pale nika hustle kwa muda kidogo nikiwa driver wa matatu hapa Supitamarmar. Alafu kutoka pale nikaajiriwa na county government baada ya kwenda kutafuta cheti cha first aid huko Nairobi, St. John Ambulance. So kutoka pale nikakuja nika-apply kazi 2017 mwezi wa kwanza, nikapata kazi, nikaajiriwa na county government, ambaye saa hizi mimi nafanya kama driver wa ambulance Supitamarmar Health Center. Maisha yangu yamebadilika tangu nilipopata hiyo cheti mpaka wakati huu. Sasa niko na watoto wawili ambaye ni yatima, ambaye wanasoma wako primary school hapa Supitamarmar.
He's also able to educate his own children. His extended family has also benefited from his good fortunes.
Sasa hizi hata baba yangu anajifunia kuwa na mimi, sababu alishinda kunisomesha. Alinifikisha form 2 na Kirisha Secondary School nika drop, lakini mpaka wakati huo amejivunia kuwa na mimi, maana sasa hizi hata nimemnunulia mbuzi, ako na mbuzi 11 na maisha yao yamebadilika kabisa. Na nashukuru sana SCAP, sababu nilibahatika tu, na ni Mungu tu alinibahatisha, maana singekuwa na future nyingine kama sijapata hiyo cheti.
Through the savings and internal lending communities, group members have been able to access funds to set up businesses, educate their children and lead overall decent and healthy lives. Elizabeth Kawira is another beneficiary who admits that setting up the ventures is no easy task. She's now reaping the benefits of her poultry farming, and so are the OVC under her care. In Garsen, members of the local support group engage in weaving and beadwork. Their beautiful handmade products are then sold to consumers, earning them a living. Similarly, in Garissa, the Galubet local saving and internal lending community has empowered its members to engage in soap making by providing them with the skills and raw materials. The innovation is now a consistent source of income that goes a long way in meeting the needs of members. As a result, they have managed to graduate 103 OVC in Garissa.
Imarisha imetusaidia kwa sababu tumepata usaidizi material ya sabuni ametusaidia, na mpaka sasa hivi tunaendelea na biashara yetu. Tuko na kikundi ya 15 na tuna graduate leo. Kwa hivyo tunasema asante kwa sababu Imarisha imetusaidia, imetuonesha mambo ya biashara. Tumeshukuru sana kwa Imarisha. Kwa zamani tulikuwa tunakaa nyumbani, hatakuwa mambo ya biashara, tulikuwa tunakaa nyumbani. Sasa hivi tuko sawa tangu Imarisha amekuja.
The Afya Plus program has also in many ways worked in collaboration with hospitals and other health facilities to ensure quality care and treatment for people living with HIV in the said counties. Major area of focus include drug adherence that is vital for all those living with the virus. Take for instance Hasera Salim, a worker at the Kipini Health Center in the Tana Delta. Hasera dedicates her time to help oversee the Kids Club, which was set up by the project in collaboration with the health center. The club brings together kids who are HIV positive and is used to enlighten them on good health practices such as taking medication as prescribed and good nutrition.
Kuna tarehe maalum ambao tumepanga, tunakuja tunaonana, tukikutana tunaelimishana jinsi ya kumeza zile dawa. Kabla hajameza hakikisha amekula vizuri, akashiba ndio akameza zile dawa, jua zile dawa zisimtatize kama ako na njaa, na asisahau kumeza dawa kwa sababu akisahau atagonjeka na atalala kitandani na hataondoka tena kama atadharau kumeza hizo dawa.
Similarly, Jamila Yusuf, the coordinator of the Kipini Kids Club, tells us of the health benefits of the program at the Kipini Health Center in Tana. The 25 kids living with HIV get support on drug adherence and disclosure process. Due to the vast benefits of the Kids Club, word spread like bushfire and the number of children visiting it grew from 15 to 25.
It has brought a lot of impact and a lot of quality improvement compared to when we started and right now. When it started, there was a lot of stigma, especially to those kids, the ones who are HIV positive living, and also the community. But through Kids Club, they've been able to, the stigma has really reduced. I
must also take this opportunity to thank FHI and especially their top management, the director Peter and the COP Ruth for the support that they have given us for the last almost 7 years in this RIFT project. I must also thank AMREF for also the support, their country director Ndirangu and the COP for the support that they have given. And not to forget the donor, which is the USAID, which gave the money and the technical support that they have been giving us. So thanks goes to them, and I must also thank my country representative for the administrative support that they have given, and also the head of program, and all my staff who have been working in that, because they are the people who have been implementing mine and the top management to give the administrative support.